Well, welcome to the channel with me, your host, Dr. Debra Durst, and I have a special guest with me today, Dr. Gaviria.
Hi.
He is traveling in to work with our office and do an advanced laser training for us. He is always training us because we are problematic children, right? We always want to learn more stuff. And he has taught us everything we know about these lasers behind us, which are the Fotona, and it's the Dynamis Pro. And so he came to do another advanced training for a new handpiece. And we're going to talk about that. But I want you to say a few words first.
Well, first of all, thank you for having me. It's an honor to be here in your office again. And as you say, we are doing a lot of trainings because this is the importance of understanding the capabilities of one single laser. That it is bringing different handpieces that has different protocols to approach in different treatments or in different modalities. A huge different things with one single machine. So, of course, you're going to have Dr. G in your office training you if you are using the different devices that comes with the laser. We are talking about the new modality that comes within a handpiece. So we are going to explore different treatments with this handpiece, but we already have the experience on this laser. And as we say, it's so versatile, is that one single equipment has two different wavelengths. Those different wavelengths will have different modalities of pulses, not in terms of energy, but in terms of time. That time is what is going to make the difference within the other lasers that are within the market. So that's I think that being part of the training of your team, which is a really nice, enthusiastic team that really cares about their patients and understanding the technology behind and becoming good users as they get the knowledge, grow the skill, grow the experience. I think that's the important thing. It's not just only press the button and try to do and mimic something. It is just don't give me the parameters. It's understanding what I'm doing, how is that I'm going to achieve it to become what here in RevitalyzeMD has become within these Fotona lasers.
Well, and he downplays it because he's world-renowned for laser physics and laser training and cosmetic laser treatments. And so we're extremely lucky to have him here training us.
Thank you.
Because you learn the most advanced protocols. And it's not even protocols. It's like you're hands-on. Like he just continues to, just look at the patient in front of you and then advance what you're doing right then based on what you're seeing. And so we're extremely lucky and looking forward to learning more from you tomorrow.
Yes, thank you.
So Dynamis, Fotona Dynamis is what he's talking about. Fotona is a laser company that started in Slovenia. Military missiles at first went into.
Yeah, it is a really nice story because, as all of that, Slovakia and Slovenia and all of that Yugoslavia countries with the Cold War and laser just being invented in the 60s, and 3 years after, almost 4, this company started doing lasers. And of course, it's a government-running company. It was into the warfare. So it's like guided laser missiles and in tanks and communications and fiber optics and everything. They were the ones that measured the distance to the moon by shooting a laser to the moon and seeing the reflection. It is also the Winter's Olympics. They were the first one to do transmission on satellites by their fiber optics. So this company that started with this, with a 10% in health system, now is just totally 100% health. It's number one in dentistry in the United States. It's number one in aesthetics worldwide. Probably not here in the States, but we are getting there because I think that people understand what a 60 years old company all made in Slovenia, which is the only country in the world that has love in it.
Well, that's awesome. Yeah, I didn't think about that. Yeah.
Slovenia,
Yeah,
right?
yeah.
So you got to
I
love it.
Yeah, yeah, yeah. And
So they only have few different components from the laser made somewhere else. Everything is put in place, and this per capita is the most or the biggest PhDs that are working in a single company. So there's a lot of engineers and great minds after. They are so great that then they have to look someone like you or someone like me to say, hey, figure it out. What we can do with this. We just embed this pulse, and I think that is going to be work. So they understand physics. They understand how to manipulate time and energy and distribute it. Now we just need to find the right applications, right? Sometimes it happens in medicine that we try to get a reflux medicine and we get another different effects on it. And that's, I think that what we are looking into this kind of laser is that the two modalities of the lasers, of the two wavelengths that are in the SIP dynamics, goes for the chromophores that are in the skin. Water, melanin, that is pigment, and blood, that is the hemoglobin. So we have the major targets in what? Pigmentations, vessels, and water. We're 80% water. So having the biggest absorption in water make us to go over different lasers that are also attracted by water and make us more superficial, which is not bad because for deep, we got the other laser that has the deepest penetration of all. So we have the most superficial and we have the most deepest one. So modulating the energy can make us penetrate more, penetrate less, but work in the tissue, the dermis, and work a very superficial, light, safe, with the erbium. So we have these two wavelengths that for your audience is erbium jag and neodymium jag. Also, they call it ND jag, the jag. So it's well known. Is one of the most aesthetic laser used worldwide. But the erbium has this capability of being 14 times more absorbed than the CO2. So that makes, like, imagine you're looking into a bunch of guys and there is one guy that is 14 times more beautiful than others. That is where your looks are going to go, right? So imagine this guy is passing through a crowd of women. Will he pass? I don't think so. Those women are going to get a hold of it. So that's what I'm saying, that I am not comparing the other technologies and making them ugly, but they will pass that crowd and will penetrate more, which sometimes is not safe.
Correct.
So this is the idea. The idea is that we have a technology that it creates a message. That message is interpreted as a damage. So we have a control damage that is within heat. So the energy from the laser that comes in a form of a light is bringing energy, and that energy is creating a controlled thermal damage. Thermal because it's raised the temperature. And that is well taken by the tissue and saying, I need to repair, I need to heal. So that the message is we need to repair. Basically using one source of energy, that it will be the laser light, going into the tissue that can be absorbed, transmitted, and reflected into different portions of that tissue that is being irradiated and creating changes. And that's what we want, because if you see the signs of aging that comes within our tissue, that is what we see at the reflection of the mirror, we see that there are fine lines, wrinkles, and it is happening because we lose that tensegrity of the skin, we lose collagen within time. So hormones also, as they get lower, we start losing the quality of our skin, and also photoaging, which is really important, and not many people take care of it. The photoaging in terms of the exposure to the sunlight, the exposure to the white light, the exposure to the blue light on the mirror, on your screens, on working all day online, that is not helping your tissue, because your tissue is the shield. Shield from the outside.
Yes.
So it is being depleted. You know, if you see as a machine, and you have this shield defense, you're getting bangs and you're getting bullets everywhere from that light, the UV light, your concept of beauty, of being suntan. That is just a huge impact on your skin. So what we need is to use one energy source, that it will be another light. We're talking UV lights, white lights. We're talking in the infrared lights, and we're sending a small message that is not bad to heal. And we don't want you to be thick. We don't want you to be scarred. We don't want you to fade away and ink, stained. We want you to be more thick. We want you to be more shiny, to have more vascularity, to be more tight. Those are the message that we want from the laser. So that is what we are looking for. We're looking for one thing, safe. Two things, minimal downtime. And three, the most efficient one. Right? So that's the goal. The goal is trying to get as maximum results with the most minimal time.
The results is what the patients are looking for, right?
Yes.
And so I think that you bring up lots of good points, and we could probably go on for laser science for a long time, because we both very much enjoy that. I think that what you were starting to hit on too is erbium versus CO2, where erbium is superficial, and how that compares, because we get a lot of questions about CO2 lasers.
That question just pop ups everywhere.
Everywhere. And people will call the office all the time, do you have a CO2 laser? And again, sometimes even our staff doesn't understand that, no, we don't have a CO2 laser, but we have something that can do it better. When you're talking about, well, it depends on what you're looking for, right? If somebody wants a lot of downtime, then potentially those CO2 lasers might be something they want, but it has to be under a controlled environment that they get that much damage. And so
I get that question from a provider. It was like, oh, but if you have to compare Fotona with a CO2, and I say Fotona because I want to compare this one, right? Because I don't want to compare we're going to compare these two lasers. But the problem is that they ask me, should I get a CO2 or should I get a Fotona? And that is a problem. Why? Because when you buy a CO2 and you compare it to a Fotona, you're comparing a car that goes with gas and a car that is hybrid. So this has the possibility of being gas, and this has a battery that being electric. So you have two things. In this laser has two lasers. So when you compare, and probably in the quote, it is going to be around the same amount of price on technology, you're buying two lasers. Now, when you are comparing these two and one, it's already done. That's it, right? So let's take out the competition within having two lasers. Now let's compare the ones that are attracted by water. That it will be the erbium and the CO2. So as I was saying, the erbium is much attracted by water, and it can be very superficial. That is the thing. We can modify and multiply the numbers of hunk guys that are going to pass through this crowd and do the repetition and create the channel of this and go as deep as we want, like mimicking a CO2.
So
So
you can
we can be
manipulate the wavelength
we can
based on
we can
what's
manipulate the energy, the pulse duration, and the repetition. So to compare, let's say that your CO2 will penetrate 10 times. That is something that is scientifically correlated. It penetrates 10 times more than the erbium. But I told you, because erbium is more attracted by the water than the CO2, so it stays on the surface. But if I need to be as superficial, I cannot do that with the CO2. I can repeat my shot 10 times and be as deep as the CO2, so I can be a CO2 with my erbium, but the CO2 cannot mimic me.
They can't reverse and go backwards.
They cannot have this small little energy to create just only one small damage. So they penetrate a lot by light, by physics. It is within their physics what is that they are so strong. And when you think about strong, think about that messenger. Do you like to speak softly to your kid, or you want to raise your voice, right? So it is trying to give the right message. And if I have to say that I don't want to wake up the melanocytes and create melanin, and don't wake up the kids, I don't want to raise my voice.
So you want to be able to talk softly and
Give the
stern
message.
if you need to, yes.
And if I need to get energy, that is the thing that with this laser, I don't need to penetrate energy with my superficial and wake up the melanocyte. I let them sleep. And I use my second laser in here to penetrate, because I say it has the biggest penetration of all. So I just bypass the skin, bypass the melanocyte, and I can go deep to where the fibroblasts are to create collagen, where the reticular part of the dermis, where all the collagen is, to heat it up and get more contraction. So I have a win-win, because I can be superficial and put my energy within the same equipment, different modalities, but I can gain the bypass of depositing too much energy, giving a strong message that can wake me up. What we call and we fear as aesthetic laser guys is the hyperpigmentation post-inflammatory. So the inflammatory effect, inflammation is an expected effect within laser, but you don't want a super inflammatory process that can get the hyperpigmentation. So we're expecting that the message is heal. Heal is a inflammatory response, but we don't want to wake up everyone and start repairing, because that is going to say the melanocyte, which doesn't know what is happening, it goes like, what is this bright light? Is this sun? Let me just put some melanin in there. And if erratic goes to put melanin, you're going to have a stain. Because he doesn't know if this is ultraviolet light or this is infrared light. For him, it's energy. For him, it's a huge message that energy is passing through the skin. So I need to ink. It's like a scare squid put in the
Well, and that's
there.
the big thing. Like with pigment is a huge complaint, right, across the board. And so again, how you hit pigment depends on the skin type, and then you have to be very cautious. And so if you can go more superficial, get more aggressive when you want to, but still just hit the resurfacing component, not hitting the pigment at all. But you can also, what I love about this machine is, so if there's a 40 or 50-year-old woman or man, because it's good for men too, they need to beautify, and we just want to heat, like you're talking about with the deeper wavelength, we can heat and stimulate collagen and elastin. And it's this, like, you're basically heating the tissue so it's comfortable, but also doing a ton of stimulation for collagen, elastin, and the fibroblast. And then you can also hit it then with what we're talking about with the erbium versus CO2, so you have where you can adjust to the patient, customize it, and you're saying you can go deep as deep as the CO2 if you
We
want to.
can be anything and do anything that the CO2 can, but the CO2 cannot do what we do. Because there is a modality of the pulses of erbium that bends the physics of the light. And bends means that the laser is supposed to get so much heat that raise up the temperature to boiling point and vaporize. That is what is a laser pill, for example, right? So that is what CO2 laser does. It's just enter a drill little holes by vaporizing tissue. With this, the physics says that you need a specific amount of energy to raise that temperature. So if you don't raise that energy, you are in a subablative energy. But there's also a theory from the 1980s that talks about the thermal relaxation time. That is that amount of time that this particular element needs to be heated up to die. Let's say a popcorn needs energy and amount of time to open. All right? So in this case, we don't want that popcorn to open. We just want it to heat, right? So we are maintaining energies subablative, and we are elongating the pulse duration. So it is a really long time. So what we are doing is putting the energy in a slow cook. We're not simmering, we're a slow cook for a long time, and that is bringing heat within the surface by attracting the water. So we are entering in a smooth modality to the tissue. So we are not vaporizing, we're penetrating because of the heat, the water attraction, and we can put it over the eyelids, we can put it on the lips, we can put it inside the mouth on the mucosa. That is the one that we use in vaginal tissue. That is the one that we use in urethral tissue. That's what they are using in anal tissue. So there is an attraction from water from this kind of modality that is just superb. And this kind of modality is not even mimicked by the CO2. It doesn't have this capability. So we are surpassing this in terms of competition. So yes, we can be as good as CO2, but imagine now CO2 is coming with a cool touch peel. They're trying to elongate the pulse, but they're still doing some ablation. So it is just trying to mimic us. Erbium has a long time, Fotona has a long time with Erbium, but we're not trying to be like them. They are trying to be like us because we have so many pulse durations and energy variations with different handpieces. Like, for example, tomorrow we're using the fractional scanner. CO2 start fractionals in the 1980s because they were so aggressive that they were just trying to get to damage some percentage of the face. So you don't have to be 2 or 3 weeks or 3 months, hiding yourself because of the third-degree burn that you get from that. But just doing small damage. So what we have and we're going to be doing is the F-runner fractional handpiece that is just going to damage between 5 to 20% of the tissue, creating tiny holes. Those tiny holes, most of the use is first rejuvenation. That was the starting in 80s with the CO2, but we are seeing the advantages on scar revision. So acne scars, stretch marks, surgical scars, traumatic scars, those are life-changing. And this, when I started using the F-runner back in Venezuela, there was foundations for burn victims. That this modality can penetrate this thick epithelium, scar tissue, and make it less visible, more skin type, because what we're doing in this message, it is enhancing the tissue. It is like, I know what happened to you. I'm sorry, but you need to be more skin type. We need to lower down the fibrotic tissue. We need to break this down. We need to be more of a skin function. So we are creating tiny scars within the scar so it has a second chance to scar again this time. So acne scars, it's not because of the bacteria. It's because the fingernails of the patient, picking up and squeezing. So in this, we use the scanner to create micro tiny holes that are going to start a healing process on the surface to see if we can resurface again and see that the skin is more smoothly, has a better surface.
And that's what we're doing a lot of tomorrow and again, we have a packed day of different people with scars, different types of scars, acne, surgical, all of it, different locations, and we'll have lots of before and afters. But this is again, we've had that piece. So when we're talking about Erbium, there's so much you can go into just with Erbium at this machine, because you can use the different hand pieces, and it depends on whether you're fractionating it, and even our small hand piece would do it, but this is the scanner. So it's a robotic scanner that we're using tomorrow. So that's exciting. But yeah, in stretch marks too is another big, and just resurfacing overall. So anybody, as we get into the 40s and 50s and we see the fine lines and wrinkles, but also the deeper, it's hard to resurface
imagine
that.
you want to do a skin tightening and you want to do some superficial damage. Will you have less damage if I just treat 20% of your skin than 100? Well, mathematically makes sense. Yes, I'm going to have 80% chances that I'm going to repair faster. But you need to see, and your audience need to understand that when you create a tiny hole on the tissue surrounding that hole just grouping and start to swallow, and that's what we call concentrically healing. So you have this hole and all the tissue is going to go this way. Okay, now imagine that you have this tissue like this and you create little tiny holes in the tissue, right? All those are going to start closing like this. If you have, let's say, 20 points pulling in all directions, that is just going to create that the tissue is going to shrink because it's repairing. So you have this double thing. You have less downtime because you're not damaging as much, but you're creating pointing vectors of tightening. So that is what the fractional, it is so popular, because you have low damage, less downtime, and you get the tightening effect. So, of course, you say, but you're tightening, what does it has to do with acne scars? Well, the thing is that we have, as I say, different modalities, energies, percentage of damage, and pulse duration to treat these different things. There is just one setting for all, but it is the new technology that is coming to RevitalyzeMD, that is the fractionating, the fractional skin resurfacing for face rejuvenation, the scar revision, and the new laser coring. Laser coring is the new technology that has been developed by the laser, trying to mimic the coring from other technologies. That is basically creating little punch of tissue, taking punches, little poking a hole, like less than 1 millimeter, and poking holes, and they are doing it on the neck, they are doing it on the areas of the cheek. So that creating a hole, mechanical hole of biopsy, and that how it is going to do is going to close concentrically. Now you're going to have a full tightening effect. The problem is that with this technology, sometimes taking that punch is a little bit tricky, and within the laser will drill it for you, and it's going to have this more tightening, because also you can deposit heat. So the laser coring is something that I know that is going to be fabulous on as a new tightening effect, rejuvenation protocol. And I mean, I am happy to be in one of the first clinics in the USA to have this technology.
Yeah, we're super excited. We didn't even know that. I know we learned that just right before we started recording,
Yes,
right?
yes.
Yeah, no, we're super excited. And in fact, Marissa's already been playing around with it a little bit because she couldn't wait
Yeah, I think that.
for the training. So,
Yeah,
yeah.
I just need to retire and let her teach. She's so good.
No, she just takes everything, she soaks it in, right? Like everything that you teach her when we go to a Fotona conference. Because again, I think that this company is unlike any other laser company, that when you go, the science is there. It's like kind of going to a peptide conference if I was like talking about medicine. Like they're deep diving into cellular science. And it was the same thing. The first conference I went to for Fotona, it was way over my head. You know, the Slovenia scientist
I mean,
then,
yeah, of course.
and then
You have all those
and
these
yes,
PhDs guys.
yes. Oh no, it's super, like it's a very in depth, and she loves it. She gets her notebook, like her book. She gets out there and she just geeks out on all of it. And
Yeah,
so
I bet that there's a lot of people that are Marisa's patients, and
yeah,
they you don't really know what is it that we're talking about. But
yeah.
it is also true that Fotona feels like a family, and you're part of
Oh,
that
true.
family. And it is like, this is the office where all the 4B was born. I give one of my way to doing female genital tightening, and you transform it into something better with the US base inside of marketing, how to address females, probably a good way to empower women and feeling secure. So, and when you talk in a conference full of Fotona users, you give parameters, you give your protocol, because there is no competition. We're family. We're
Yeah,
sharing.
I would
How
agree.
will you do it? How do you do it? How do you approach? And I think that this is very important about this company, because there's no big egos. We just share a lot. We feel like a family. You get a laser of Fotona, and we go, well, welcome to the family. We're so happy to have you. Did you know that this gynae, do you know that this derm just got a Fotona? It's a great thing for
Awesome.
us,
Yes.
because they understand that their name under this technology makes our technology better. And
Yeah.
that's important, because they are also thinker out of the box. If I know how to do this, could I apply this to this?
Well, I think that's where you play a crucial role. And the clinicians that are also scientists do, just like yourself, is because you take those scientific protocols and now are adjusting how you apply them. And that's how the 4V came to be, or the vaginal tightening is because it was the 4D. And you're like, well, you can do this on the vagina too. And you taught us protocols, which we just came back and implemented. And then as you start to adjust it, then again, we all meet up as a family and talk more about, what we're seeing and how to change it. And yeah, no, it's an awesome company to work for. And it's an awesome machine. We're lucky to have you teaching us tomorrow some advanced technology. And I didn't know until earlier that we were one of the few, like maybe three.
Yeah, first.
Yeah, one of the first in the U.S. that has this scanning technology, and so we're gonna do scars and stretch marks, and then some coring, and so. But I think the big question, not even the big question, the clarification is that there's CO2 and then there's erbium. This doesn't do just erbium, it does an Nd:YAG2, which is a different wavelength, but they can manipulate the erbium wavelength in such a way that there's so many different applications for it. But also when we get the question of CO2 versus erbium, I think the big thing that comes from this is CO2 is like almost, there's a one mode, and it's going to ablate, and erbium is usually ablative, so you're usually kind of addressing the surface, but you can manipulate the wavelength where it's not ablative in the Fotona, which I think is the only machine
He's the
that
only
can take an
erbium that does it.
erbium that does a non-ablative mode.
Imagine this. Every laser is measured in a wavelength. That's why we call it wavelength, right? It's like the frequency, how that energy travels. And by definition, all the lasers that overpass the 2000 nanometers is in the size of the wavelength, they are known as surgical lasers. So like erbium and CO2. They're surgicals because when you apply it, you vaporize. And if you continue in a single line, you're
cut,
opening,
yeah.
you're cutting, right? So, but yes, this is out of the box, like the manipulation by the PhDs in the pulse duration, time, energy, subablative, long pulse, all those theories were like, for the people who understand lasers, it's like, wow, is this for real? You know? And this laser being an open software, like you can do virtually anything with any handpiece. So it is not just no, don't touch that. No, you can manipulate the pulse. And if you think that this is going to work, I mean, you are just giving messages, you know, you're translating to a different, taking it to a different kind of language. You're saying, well, if this vibrational state of that energy is going to help me with this amount of energy, what about if I put the half of the energy, but I elongate the pulse twice as long? You know, it's like, well, that's how you bake a cake, or you put 220 minutes, or you put 410. You know, well, you're going to have a thicker crust in one, more soft in the middle, but that is how different cooks are. And sometimes this is something that is interesting. There is people that understand how to cook on a gas stove or electrical stove. But if they have the skills and understand how that heat is transmitted, they will do wonderful things. Yeah. So I think that this is a great technology, but as everything has to have knowledge base and has to have skills, right? Because an arrow is an arrow. But the people who shot the arrows can be very dangerous or very skillful and put it where it has to be. So this is important for the company also. It's not having a good name and years. It is having a continuous medical education and people that are working and doing, I got a 4B. Can we get this Dr. Durst to come to and say what is that she's doing? What is that? What did she find? How does she has these beautiful results? Well, and what she does, she goes with all the team, give parameters. She didn't hide. This is what I do. This is what I do before and after. Buy. No, this is what you see in some other in everywhere. Like this is, I have wonderful results. Everybody's happy. Buy. No, this is my results. I elongate this pulse, I try this, I change this for this, patients are more satisfied, I use my cooling in this. So you give us a way to do it. And you have a lot of patients that are very well satisfied, before and after talk by themselves. And I think that that is the most important thing, because what makes you stronger here in Knoxville is going to make me stronger in Houston, where I am, because they are going to Google. I want a 4B. And I'm going to, okay, but 4B is a protocol, but she was using Fotona. So they are going to type Fotona near me. And if they are in Houston, Katie, I'm going to pop up. So your good things are helping me to achieve patients that are looking for this technology. And what you are receiving is calls because patients only use and see laser CO2, laser CO2. I think that we lack this exposure of understanding this magnificent technology that can achieve different modalities can achieve the good results as these different modalities will have. So I think that this means of having these conversations and being directly to our audience that are the people who are looking for these kind of technologies, it is much important. That's why I say, oh, we want to do a podcast. I was like, I'm so happy.
Yes,
Yes.
And
Because talking with you is fun, because we have fun talking about scientific stuff and good results and being here in your office. But I think that it's important for patients to understand that there's new technologies, this is new advance. And when I say new technologies, probably for the public here. But remember, this is a 60-year-old laser. So just 4 years after the laser was invented, the company started working. It's the worldwide first laser in aesthetic, first one in dentistry here in the States. So it's not that we are into a new technology. I think that it's just like, like I say, well, it came in the Titanic, but it sank. So it didn't get to the States within a while. And the problem, what I think, being a foreign citizen here, FDA.
Yeah. Well,
it's a big holding on let's study, let's do it. And I think that what it lacks is studies that compliance to this agency to see that what we do and we make people happy and improve quality of life is true.
True. But that actually brings up a whole nother dimension of the Fotona, right? Is that it's not just an aesthetic laser,
Nope.
that it can functionally improve a lot of things. And when you're talking about like sexual, dysfunction in women, for instance, this machine can do so much to improve it. But that is where the FDA definitely comes in. We're almost from a medical standpoint looking for studies, and there's studies there to show it.
We have more than 100 clinical studies published into this, and it is like, well, yes, they published this in Europe and this published this and that, and they're making patients not to pee themselves in Europe, but here we need to have a double-blind control, sham control, double-blind, whatever, multi-center thing that is, it is difficult to have. And I say, well, you know what? If I have one patient that is happy and she's not peeing herself, for me that is more than enough, because it's quality of life, and I cannot measure that. And
it's 100% improvement if it's one patient that got improvement. And so, but the safety is there, and so that's the big concern is. It'd be hard to double-blind, randomize a laser because you're going to get heat no matter what. And so somebody will know whether they got a treatment or not. So that part is impossible. If you look at like case studies or observational studies, or a lot of things in female sexual wellness is surveys. And so if you look at surveys, there's no safety concerns.
No.
And the results are there. And that's all you're really ever going to get. And patients are more progressive than providers and, the medical community and the three-letter agencies right now. So.
But the good thing is that, for example, I have been working with magnetotherapy, and magnetotherapy, it is the same source of energy, right? For example, these big lights that are here right now helping us to look better, to see better. These electromagnetics, it is the same.
Aging us while we're
we're talking. I feel the age coming.
Feel the age.
This is electromagnetic energy, right? So the magnetic therapy, it is a disassociation of electricity and magnetic fields. So there is a colloidal battery that creates a magnetic field, and that magnetic field, if you put it in contact with human tissue, is going to depolarize muscles, creating an non-voluntary contraction of the muscle, right? So I have been using this technology since 2016, and from these 9 years of using it, combining muscle with tissue into my woman's health treatment has been great benefit for my patients because what you have in the pelvics, muscles and tissue, right? So working into the female wellness for incontinence, for genitourinary syndrome of menopause, for vaginal relaxation syndrome, has made me realize that the changes on the anatomy of the human as we decide to walk in our legs change the full impact on the pelvic. Now, with this magnetotherapy that you just sit in a colloidal battery and that you increment the energy and you modulate the frequency of the magnetic. As you modulate the frequency of the magnetic, you're making the muscles contract or not, or maintain and relax, and maintain and relax, or maintain, relax, maintain, relax, maintain, relax. So you modulate the contractions. So you create supracontractions that are not well done voluntary. You just contract or contract. But also you have enrollments of muscles fiber A, B, and C, which they have different control on movement because the ones that are fast responders, medium responders, and a slow responder, that depends on what do you need that muscle for. Do you need that muscle just to run away from the dinosaur, from the lion? You need fast movements, or you need a slow movement but that involve more fibers because you are lifting weights. So you have all those fibers in your muscles. So there are ways to approach these different fibers with different energies and modalities of frequency. So imagine this machine that you can just sit with your full clothes and you are doing kegels. 18 to 25,000 kegels in 20 to 30 minutes of just sitting down there, right? So this magnetotherapy was introduced for me in 2016. I did a 2-year study with this, with the use and mix with lasers. I came to the States and, well, FDA, not been approved. So now there was another company that got it into the country for uses on muscle tone, like getting a six-pack or getting your gluteus tone, and also did a chair. So the chair that I use has a battery where you sit and one battery that you recline on. So you have a double battery. So you're creating a field that goes into the pelvis and a field that goes into the lumbar sacral way. So what is going there? Muscles? Well, no, because as I say, the magnetic field depolarizes the neurons. So what you have is all those nerves that goes from the spine, going into the ponytail, going down to the pelvis, and now you're going to have a neurovascular muscular biomodulation. All of that, a huge, big name, but you are involving your nervous, central, and peripheral system. You're enhancing vascularity because of the changes on vasodilatation, and you're contracting muscle, right? So let's say that you have an overacting bladder. You don't need pelvic support. What you need is something that tells that bladder, stop, relax. You don't need to contract so much. You just contract whenever she wants to pee. So that is a message to the bladder sometimes because we have more muscarinic receptor, and that's what big pharma makes money selling the shh.
Yeah.
Muscarinic receptor, shut up. No. Why? Probably what we need is that central system to stop that erratic thing into your overacting bladder. So that also can be modulated by sitting on the chair. So no, everything is a six-pack. It is this. So as we think, well, I have this laser that helps me with tissue to get support. So I can sneeze, I can cough, and I will not pee myself. So I am enhancing stress urinary incontinence. But then you have
Functional improvement.
the one that is within the bladder, within the muscarinic receptors, that is the urge, that is the overacting bladder, that sometimes can be mixed with stress, but if not, we are not doing anything but sending pills to the patient. With this, we have another approach that is probably a 20-minute sessions 2 times a week or 1 time a week, 6 to 10 sessions. So you came, read a book, 20 minutes. Meanwhile, they can get orthomolecular vitamins as they are sitting on the chair. And the good thing, now it's clear for stress urinary incontinence here in the States.
And see what happens when we, so Dr. Gaviria is also an OBGYN. And again, see what happens when we start talking about FDA approval and like machines and in what can be done functionally. But that's a different machine. We are going to do a little segment on that because they just introduced the Starformer. They have like the Time Walker. We have some other
Star Walker.
And then the Star Walker. They're all like a little close. Starformer. So they just debuted that in October for the first time. And
we're very happy.
Yeah.
I am very happy because remember, I have my machine since 2016.
Yes.
And she speaks Spanish because I got it in Spain. So I brought it here with me and I was using it. And as I was saying to my patients, well, this is CE approved, but this is not FDA approved. So with your consent, I'm going to use this on your benefit. You know, you can always do off-label treatments, but now that is FDA approved, now I can market to my patients that are peeing and leaking when they sneeze, they cough, they laugh, they are with friends. Now I can advertise that this machine works for incontinence. So that makes me very happy because many people, many of my patients knows that I work with this with functional gynecology. You know, functional is trying to help what age and deliveries has done in a traumatic way, but since this got into the approval, now more of my fellows gynaes are are going to address it, and they're going to see that the benefit that magnetic therapy will do. Now they might probably consider electromagnetic therapy in a form of light to improve also the tissue.
Well, you bring up an important point, and then I do want to do like just one segment that talks about the Starformer because, again, I think the fact that we can treat functional improvement for women for sexual dysfunction or urinary incontinence, and we don't need medications, you don't need surgery, you don't need implantable devices, but it does bring up the important point that I want to go into specifically about that Starformer is that a lot of traditional docs will wait until there is an FDA clearance for something, yet patients know and see and they talk and they're on forums and they know what works. And so they don't always need what the medical community does need. And so now they'll be willing to do it because it's been FDA cleared for them.
Probably I think that, yes, the FDA approved on the incontinence can be like a Trojan horse to bring more technologies available for female women's health, for women's health as different devices, different platforms, different technologies that or protocols that are available. And right now, that my fellow colleagues are just waiting for that double blind.
Oh yeah. Well, they might still be waiting for that a little bit because it's kind of hard to do that and blind somebody to it. But I think that as far as so we're going to get into the Starformer. That's a chair that, again, is new to the U.S. with FDA clearance.
So the Starformer, as an equipment, it is a platform that has 4 batteries, okay? So the Starformer as itself works attached to a chair that has 2 batteries, but you still have in the machine 2 outputs, and then you can put 2 colloidal batteries in the top of your abdomen. As you're sitting, now you have 4 batteries going at once, doing a full core treatment. So imagine your pelvis, your lumbosacral, and now your rectus muscles being there. So you have a 3-dimensional way, we call it the core treatment, to improve first, posture. Second, helping with all the tissue and inside, because it's not only muscles. Depending on the modality that we use, imagine a male helping and improving the vascularity on his genital area to improve his ED.
Yeah.
Yeah?
Yeah, and going all the way to the nerves and the pelvic floor and strengthening. Yeah, everything.
It is. I mean, if someone has experience magnetotherapy helps with plantar fasciitis. Helps with conditions in the knees, like cartilage. Meniscus. It helps also with after bone fractures, because of what it's doing. It is just not a magnetic way to start muscle contraction, because that was created for. It was created to get the person who was in ICU to do some contractions on the muscles as they lie there because they cannot move, to don't lose the muscle, because if you don't use it, you lose it, right? So this is not there. In April and in May, Dr. Gaspar, who has been working with this core therapy or using large muscles, because as I told you, the Starformer connects to a chair or has 2 adapters, but you can put 4 adapters, so you can be getting a full 6-pack, and you can be getting gluteus, or you can be getting arms. So we are
targeting a total of 6.
No, it is 4, but you attach it to the chair and 2 manipulas, 2 handhelds, or you put 4 handhelds.
Gotcha.
So if you want just the aesthetic portion, because you're just doing muscle, you can do that. If you are into both, you get the chair, because the chair is going to help even with pelvic chronic pain, a lot of stuff that can be done in there. But the new approach is to think that, and this is very interesting, because when you contract muscles, right? You get a release of a protein with this contraction. The name in English is.
Did you say increase the protein?
Yeah, it's a protein that is from the muscle.
You're not talking about myosin? Actin?
Myosin.
Yeah.
Right. So myokines. Myokines are the proteins that are released by the muscles. These myokines, now, it has been proved that they are like muscles is the biggest gland glandulas is organ.
Yeah.
That will be having apocrine and endocrine function by the myokines, because they are going to talk to the bone, to the brain, to the bone. They will talk to different organisms, and these myokines will increment some of the regulation of immune system. So by releasing myokines, that is, will be with contraction. And how you do contraction? You do exercise. As you do an exercise, you have a well-being, right? So there's no big science on this. Now, you have a patient that is coming for your orthomolecular in this room getting an IV therapy, right? Mm-hmm. But you put your contraction batteries on the muscles here in the big muscles. You're not aiming for big quads. Mm-hmm. You're just aiming for the release of myokines. Mm-hmm. These myokines are going to increment the TNF alpha. Mm-hmm. That for our audience is just like another messenger that is going to reduce inflammatory processes. So as you are contracting your muscles, you are lowering down inflammatory processes. So this, for the persons who have chronic inflammatory problems and creating a lot of free radicals, this is going to be another kind of therapy. So it's not only peeing, it's not only erectile dysfunction, it's not only big six app, it is going to be part of the release of myokines into the system.
So a big anti-inflammatory effect as well.
Yes.
With all the positive benefits of that. So, well, and I sat in the chair in October. Mm-hmm. It's pretty intense, I will say. So it is intense.
It
like
is.
The feeling that you get from
it is something that you understand. You understand, like when you're sitting and some muscles that you didn't even know that they exist are contracting. Yeah. You go like, well, that by myself in a voluntary way, I will not be able to contract. Yeah. I don't have to be naked. I don't have to put electrons on my skin. I don't have to be in touch with something. And all my superficial and deep muscles are contracting according to the battery, according to the Tesla field, because it's measuring Teslas. And this has something that the other technologies doesn't have. The 4 batteries can be at the same time, can be sequential, or can be 2 and 2. So this is an advantage that also you can modulate and create programs. Mm-hmm. Probably you might need to understand a little bit on the physiology of the muscles, how much needs to be contracted, mm-hmm. and how much time it needs to be resting so can blood get into it. And that's why we get a lot of vasodilatation, because they need oxygen. Yeah. So, but you can modulate and you can create your own presets, and you can, I think that open systems in this kind of technology is very much important. It's just not, just sit the patient there, press one, and that's it.
And anyone can do it. No. So it was intense. And I will say that, again, I thought people were talking to me at the time. And I was like, I don't think I can talk right now. Yeah. So it's an intense feeling. But so I think that's the Starformer in in a very simplified nutshell, I guess, because again, it is using electromagnetic radiation to hit everything, the nerves, the muscles, but also to send electrical or chemical signals throughout the body for anti-inflammatory effects. And so another treatment for both men and women, and progressing women's health too with the incontinence. And there is that question of whether or how much it would improve sexual function as well as you increase the blood flow, the pelvic floor health, all that. So, well, that's awesome. So I love it. We don't yet have the Starformer. We were introduced to it in October. And again, we are just about ready to open a second location. So we needed to do that first. We need more space. As you can see, the garage was pretty full back there. But we're going to, so I think just circling back to the CO2 to close this out, like CO2 erbium. Erbium, you can do a very mild kind of sanding down. I like to call, when I talk to patients, I'm like, you can sand down over time. You can use a really high grit sandpaper and get it all at once with lots of downtime and pain affiliated with that. And that's what you're talking about if we went deeper with the erbium, which we could do, or the CO2 all the time, because you're going to ablate like that. But a lot of people don't want that pain and downtime. So we have the capability of going more intensely and deeper and getting more of an ablative effect in more downtime. But most people don't want that downtime. And so you can just do it in a more mild fashion over time. And tomorrow we're going to do it where we use that again. Those, and we'll put up on the video like almost a square that shows the circles, so that you're hitting those circles instead of the entire area. And what Dr. Gaviria was talking about is that those areas start to contract down, and all the healing that goes around or that goes on just with the messaging of the laser light on the tissue, and that, you know, controlled injury and healing. And I don't think people talk about lasers enough and everything it can do. And again, the science is amazing. I don't even think people understand what lasers are. They're scared by them. And now when you said that people equate CO2. So the reason that I have seen that question a lot lately is I was doing a lot of SEO research for like website and even just some landing pages. And it's interesting because when you put in lasers to see what's being searched, it's all CO2. And so I don't think people understand what lasers are. They equate lasers to be CO2. So there's a big difference, and that's hopefully what we laid out today.
It is also thinking about toxins. You know, neurotoxins for blocking muscles. They only go for one name.
Yeah, no, Botox. It's a verb, right? Yeah. So now we know CO2. I might actually do that because I always do videos where I say Botox is a verb. I've been saying it all along. If I say I'm going to do Botox on somebody, you know, I don't mean go pull the Botox bio out. I'm just saying I'm going to block their muscle. Yeah. So I think you're right. Like, again, CO2.
I mean, I got a patient that called me to, I don't know if we can call names, but he was like, do you have this Botox named Xiaomin?
Oh.
Do you have this Botox named Xiaomin? So, you know, you have this Toyota name. Yeah.
No, I think that's, you're right. They equate CO2 laser as a laser. But yes, laser is so much more. And the Fotona is so much more. So, well, good. Well, thank you for deep diving into both of those topics with us. And we are going to deep dive into some good training tomorrow. And we have the most advanced and knowledgeable cosmetic functional laser physician and scientist that is even like able to bring it to offices and physicians here. And so we're so lucky to have you. And you're right, it is a family, and we feel that every time that we interact at a laser like conference with the whole Fotona company. The company's amazing, and so are you. So
thank you so much.
Thank you for coming, and we look forward to doing the training tomorrow. And then we will do some videos that show some before and afters, and we'll talk about that. Yeah.
All right.
All right. Thank you so much.
Thank you so much.